Have you ever felt that words weren't enough to help someone heal? In some cases, just talking could even re-traumatize. To help us understand this roadblock, we will be interviewing Dr. Pat Ogden. We will discuss why words aren't enough to help certain patients, and the importance of integrating body awareness and even touch when treating those who have experienced trauma.
When we talk about talk therapy, it's kind of a top-down approach where we're working with cognitions, for example, of trying to reframe the present moment as being safe and not dangerous, and hope that that will have a trickle-down effect in the brain to calm the limbic and the reptilian brain, and also in the person's, psyche, so that they feel safe. But a bottom-up approach, which is what sensorimotor psychotherapy integrates bottom-up with top-down, we work with the body directly to affect the lower levels of the brain and then track how that changes the thought process.
And we're not just discussing the concepts of sensorimotor psychotherapy. We get into the meat of the matter and address how practitioners can apply this technique to help a variety of patients, including people who don't fit the typical profile of a trauma victim. These treatment approaches have valuable applications in doctors' offices and hospital rooms. They can be used for a patient who's just undergone surgery or received a diagnosis for a catastrophic illness, such as cancer.
Well, one of the main things is to take time with the patient and kind of track the patient to see if they're engaging with you and try to get their participation with you. Because if they start to get immobilized or go into a panic, that's going to re-stimulate the whole trauma-related circuitry in the brain. So one is to stimulate their engagement with you, and two is to help them take assertive action, help them be in control, and offer suggestions to them for how they can be in control. There is research that shows that if you can take action, if you can do something positive in your own behalf, there's much less chance of being traumatized.